Dr. Elena Poulos.
I'm Dr. Marnie Fisher.
And today we're here to talk about the most effective ways to treat pigmentation in the skin. As dermatologists, we get asked a lot about how do I remove these pigments. So I've got red spots, brown spots, blotches, patches. And so today we're going to talk about the various methods, different types of lasers, IPL, BBL, so you can help to understand the different factors and find out what's the best way to remove your pigment.
So one of the most important steps in treating the pigmentation is to have an expert decide what layer that pigmentation is in the skin. Is it superficial? Is it deep? Or is it both? Because that does happen as well. And then what is the pigmentation that is casting that look into the human eye? Sometimes there would be a little bit of extra redness in the skin and it's not all brown. Maybe it looks like a splotch or a blotch, but it could also be a little bit of increased blue vascularity left over in some of the acne scars that we see. So it's important to have that first eye cast onto the skin to determine what the pigmentation is.
Exactly. So it sounds so easy, but really not all brown spots are the same. So one of the things we really think about is what causes that pigmentation and how does it occur over time. So one of the big categories is really from sun exposure. So we know people as they get older, particularly people with very fair skin, as they're exposed to UV over time, they'll get different types of pigment. Most of that time that pigment is in the upper layers, both in the epidermis and in the very surface layer of the dermis.
So there is a challenging concept of determining a freckle versus a lentigine, and they all look like brown spots, versus a macular seborrheic keratosis. And they can all look identical, but they don't all respond to the lasers the same. So inherently you need an expert with a suite of different possibilities to tackle these little brown spots that pop up on certainly the face, the arms, the forearms, and the whole chest and décolleté that progress with age. So it's sun exposure, because chronicity of sun exposure increases as you age, and then these macular seb cares come up as we get older as well. One of the more difficult problems that we get asked about a lot is melasma. Melasma is very complicated. It can be epidermal pigmentation. It can come up with some hormonal changes in life, mainly females, mainly sort of middle-aged to perimenopause, postmenopause type age. And it is definitely influenced by UV exposure, namely sunshine. It can be very, very difficult to treat and then maintain.
Another type of pigmentation that we see comes from a different mechanism altogether called post-inflammatory hyperpigmentation. So there might have been an injury, a trauma, inflammation from different causes, causing a background of hyperpigmentation. And yet a different type of pigment can be caused from certain type of medications. So as dermatologists, the first step in this process of treating brown spots or treating pigment is really actually in backing up and understanding what the cause is and understanding what type of pigment there is and also where in the tissues that pigment resides. So that's some of the cause of, let's say, brown or hyperpigmented spots in the skin, but then there's also reds that we see caused by underlying vascularity and blood flow.
So hemoglobin, both oxygenized and deoxygenized hemoglobin, is the main chromophore which gives off a red or reddish cast in the skin. And of course, hemoglobin is found in a red blood cell, and a red blood cell itself is found in a blood vessel. So there's many skin conditions that leave additional red blood vessels superficially in the skin, casting a pink or red glow, or creating a dilatation of those red blood vessels, even giving a red face or a red complexion that people don't like.
And sometimes, depending on the patient, we can see the outcome differently. And there are some individuals where you might see large, really obvious looking vessels right on the surface of the skin, for example, around the nose. Sometimes you see like just a back background of red, and when they compare that to the skin on their neck or other parts of the body, it just looks like their faces just always has this red look to it. Sometimes in people, particularly with darker skin tones, that hypervascularity or this increase in blood flow under the surface can cause their skin to hyperpigment and actually look browner or darker on the surface. So the underlying vasculature in those blood vessels can also contribute to the overall look and color of the skin.
And with regard to sun exposure, sun is really a big culprit in one particularly funny but interesting problem where people come in saying, what's this rash on my neck? And it's called poikiloderma of Savate. So it's a perfect mix of light skin, dark skin, and red skin, which is very difficult to treat, and it's all sun exposed. So wear your sunscreen, please.
Yeah. Yeah.
And you can look that one up.
Okay, so let's think about different ways that we can treat this pigmentation. So whether they're browns or reds or a combination of both. So what are the different methods? So certainly we've got lasers. There are certain creams that we can do. There's prescription options that are available. And although all of these certainly have a role, we find that treatment with lasers in particular really tends to be the fastest and the most effective and most predictable way of treating most of these types of pigments and vascular lesions.
So a lot of times the word used to treat the combination of reds and browns together in certainly a lighter skinned individual, IPL and BBL and phototherapy. Those are interchangeable words or titles in a lot of people's vernacular. But here at Kingsway Dermatology, we have a BBL machine with Sciton that we have used for 12 to 15 years that we are very, very excited about. And it is a workhorse for those pigmentations.
So one of the benefits, and if we sort of step back and think about, okay, what are the different technologies that are available to the consumer for treatment of pigments? So IPL was one of the first ones that came on the market. So let's kind of think about that as a basic entry. So IPL stands for intense pulse light, and it's really a broad band of different wavelengths of light that come out of these machines and target the skin. So they were the first, and yes, they can be very effective. One of the limitations with IPL type machines is that they may not be as precise. So because there's this broad and differing wavelengths of light that come out, the targets and also the particular skin type and color that is treated can be limited. So the next generation is really considered the BBL, Sciton's BBL, and how it's different is that there's really a lot more customization that can happen with the treatments. So the entire treatment can really be varied according to the diagnosis and what type of brown lesion we're treating, also according to the skin type of the patient and how large the lesion is. So there are factors, for example, there's filters that can be changed in the BBL, which allows us to pick, let's say, a narrower focus of wavelength of light, which allows us to hit certain targets preferentially to others. There's things like the spot size, so how large an area we're treating, the fluence, the cooling, the amount of energy per shot. All of those are different variables that can be adjusted to make these treatments safer and then more effective for a particular skin type and type of lesion that we're treating. Other lasers used to treat pigment include lasers like alexandrite and Nd:YAG. So these are lasers that have specific wavelengths of light that come out of the machines. One of the things just to be watchful of and always to ask is, in any particular type of alexandrite or Nd:YAG, is were those lasers actually designed with the removal of pigmented lesions, or were they actually designed for laser hair removal? Because they can be quite different. So for example, certain Nd:YAG, the target is very, very deep. So they penetrate very deeply into the skin. And so you can imagine if the pigment we're trying to clear is sitting very high up on the surface, they're really not going to be as effective.
Often the Nd:YAG you'll hear used for vascular lesions, and a lot of the vascular lesions we are treating are located deeper down in the surface of the skin. So sometimes if there's a pigment chromophore that you don't really want to hit, gets in the way of that vascular target, it can absorb too much heat and not have the specific outcome that we're looking for.
And the other thing, of course, to consider is the baseline color of a particular patient's skin type. So particularly for people people that have darker skin tones, you do have to be very, very careful. So we're trying to target excess pigment, but without targeting their natural pigment and their natural skin tone. So certain lasers, for example, the Alexandrite, can be very tricky if you're treating people with darker skin types. So let's talk about different types of pigment and different indications and what we most commonly see for treatment of pigment in the clinic.
Some of the pigmentation is located a little bit deeper in the dermis and or can be a little bit more stubborn to treat. So that's where the halo, the fractionated ablative, hybrid and non-ablative laser can step in. And certainly our Moxi laser, which is a very, very fast energy delivery system for the body. So we get a lot of ask to clear up brown spots, both lentigines and ephelids, as well as just general sun damage, some vascularity, some basically modeling of the arms, the back, the forearms, the chest, as well as the neck. It's very safe to break up that pigmentation with Moxi. And it is maybe our first go-to. It can also be combined with the BBL, and that is a perfect pairing for chronic sun exposed skin, getting it more blended out, more radiant, has a real glow after we're done. And those are the results that patients are coming in for, certainly.
Really, one of our most common indications are people that have just a lot of sun damage accumulated over many, many years. So not just the face, but the neck, the chest, the arms. One of our favorite devices to treat this is the BBL Hero. And I would say that particular platform is amazing in that the speed of the treatment. So this BBL fires off so quickly that it allows you to treat a very, very large area of skin very safely and in a way that's highly efficient. So even within a few treatments, people are just feeling an overall comfort. We often combine it with other treatments. So for example, most people have more than one type of pigmentation on their skin. So let's say we've treated a lot of the sunspots or the lentigines with BBL, and now we have some of those flat seborrheic keratoses. Well, we can go back and use our ablative treatments and the non-ablative treatments like Moxi, Halo, or even the full erbium to clear off those stubborn spots that did not clear with the first couple of passes with the BBL.
And that's where you need a real eye to determine what is this pigmentation lesion that you're looking at, to go back and ablate these flat seborrheic keratoses or large seborrheic keratoses, because one person can be so inundated that maybe it's even 50% of what they're dealing with on a different part of the body.
Yep, absolutely. So coming back to one of the points we make over and over again, it's really very important that before you go down this journey that you have a proper assessment by a qualified dermatologist to really understand what is it that you're looking to treat. So certainly the diagnosis. Treating melasma is completely different than treating somebody with sun damage. Treating somebody, let's say, with seborrheic keratoses, which are these spots that come with age, will be entirely different than treating ephelides. The indication really matters a lot. And then once we've got that indication, then we know how to use the tools to get the results that we're looking for. So getting back to where we started, which is really what's the best way to treat your pigment?
Well, it really depends. It depends on what that pigment is, what it consists of, whether it's complicated, whether it's two chromophores in one that you're dealing with, what is your base genetic underlying tone of your skin. We want to be protective of that epidermal inherent melanin condition. And then you need an eye, and we need safety first to prevent any PIH or any problems, because we've all seen the posts of the stamping problems on somebody's arm, whether it be for, usually it's laser hair removal, but it is not easy to fix. It's fixable, but not easy to fix.
So there's a few things that we have to be cautious about as dermatologists, and of course you as the end user. So one of those things is for people with darker skin colors and darker skin tones, you really have to be very careful. Treatments like IPL, BBL, there can be a higher risk of getting hyperpigmentation in patients with those darker skin tones. So often for patients with those colors, we'll switch to different technologies. So that's often where we will reach for the Moxi or the Halo, because it can be actually a much safer way of clearing pigment for patients with darker skin colorings.
The energy packets and the dispersion of the density per hit and then the room around it is quite tunable to make sure that there's just not too much heat delivered in any one area, but it still breaks up the pigment and causes a regenerative effect in the skin and a proliferation, a healthy new vascularity in the skin, and it just gives the skin the healthy glow to break up the pigmentation. One other point that I'd like to bring up is some clinics are doing this, ours are. We sometimes use the laser treatments as a channeling device instead of microneedling. So we get bigger bang for the buck for the patient, and we can deliver some of the topical medications to the skin after the treatment, which is a next step, additional step to the laser treatments, which is really helping indications like pigmentation and getting patients a more even skin tone.
Exactly. So that whole concept is called laser assisted drug delivery. And it's really, we love doing it. So for example, we can use a laser like our ProFrac, which is delivering little microchannels into the skin. And then you can apply a medication called tranexamic acid, which really helps to minimize and even out pigmentation, particularly in the deeper layers of the skin. One of the other indications we see a lot are people that have had a lot of sun damage and pigmentation on their body, so chest, arms, legs. And sometimes, particularly with the older IPL devices, there can be a phenomenon seen which is called striping, which means that as the laser pulses along the skin, you get certain parts where the pigment is completely removed, and then the part of the skin right next door actually still has the pigmentation. So it's considered a complication, and people can come out honestly looking like a little zebra with stripes, and obviously not what we want. That's one of the reasons why we love the BBL, and there's the Hero and then the newer Heroic platforms, and these have been designed that the laser pulse comes off so quickly that it allows the person performing the procedure to make sure that every little bit of the skin is treated. Think about it as smaller, less intense pulses, but delivered in a more even distribution, and that way we really minimize the risk of having striping or having these bands of skin where the pigment remains while the other pigment is cleared out.
Not only is the BBL Hero delivery more even, which is very important for safety and outcomes, but it's better tolerated and it's faster.
Yes.
So it has all of the ticks that everybody wants. The performer of the gliding mechanism of the Heroic BBL plus the patient.
So patient comfort for sure. And then the other added benefit, which we also love, and it's almost like an extra side benefit, is that with the BBL, they've done studies that show that with the Forever Young protocol, because you're getting such a rapid fire hit of energy into the skin, we know that it's excellent for collagen stimulation. So you also get improvement of the texture and tone of the skin.
Okay, so that was a lot of information yet again.
Yeah.
And what should we take away from watching the video today?
It's complicated. So there's a lot of different types of pigment, and there are different types and different layers. There's a lot of different types of technologies out of there and different ways to use the technology. So again, make sure that you seek out qualified advice and qualified care. Ask all the right questions. Get your consultation. I'm Dr. Elena Poulos.
I'm Dr. Marnie Fisher.
Please drop us your comments, your questions. We're here. We'd love to answer it. We love lasers. We love doing these treatments. Most importantly, we love taking care of patients.
Yeah. Thanks for watching.
Thanks so much.